This video is sponsored by Balance, the 100% natural formula that has helped hundreds of thousands of people around the world reduce their blood sugar and control their appetite using the power of natural, scientifically proven ingredients. If you struggle to control your blood sugar and still want to better control your appetite in a hassle-free way, check out the first link below in the description of this video. Well, let's go to the 8 most classic signs that your blood sugar may be out of regulation and the risk that this can pose to your health. Frequent urination, fatigue and blurred vision are just some of the symptoms of uncontrolled type 2 diabetes. Number 8. You feel tired and fatigued constantly. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar, says the ADA. Put simply, when your body isn't processing insulin properly or doesn't have sufficient amounts of insulin, sugar stays in our blood instead of entering our cells to be used for energy. Also, frequent urination can lead to dehydration, which is another contributing factor to fatigue. Number 7. Visibly blurred vision and frequent headaches. You may notice that your vision is not as clear as it used to be and that things may seem a little blurry. High blood sugar levels can lead to swollen lenses in your eye from leaking fluid, according to the Joslin Diabetes Center in Boston. This changes the shape of the lens, which makes it unable to focus properly, causing blurred vision. You may also encounter difficulties at work, difficulty driving, and frequent headaches, notes Emanuele. Number 6. You're hungrier than usual, but you're losing weight. According to Medlineplus, many people with uncontrolled high blood sugar find they are hungrier than usual, which signals a symptom called polyphagia. And even though you may be eating more, you could be losing weight for no apparent reason if your blood sugar levels are too high. The explanation, according to medical experts, is, as your body is not getting energy from the preferred source, glucose, it needs to turn into muscle and fat. When your body starts breaking down muscle and fat for energy, you experience unintentional and mostly unhealthy weight loss. In addition to these weight and appetite changes, you may notice muscle weakness and more frequent falls. It is worth remembering that the Balance formula can assist in this appetite control process, as it contains 8 supernatural ingredients that reduce blood sugar. The link is in the description of this video. Number 5. Wounds tend to heal slower than normal. Diabetes causes nerve damage and affects circulation, especially in the lower legs and feet, which can delay healing because there is not enough blood flow to the area. In this way, even minor wounds are more prone to infections, which can become very serious and even result in amputations of the foot. You may notice drainage running down your socks or an unpleasant smell if you develop a foot ulcer, notes the American Podiatric Medical Association. Number 4. Tingling and numbness in your hands or feet. As mentioned, uncontrolled blood sugar can cause nerve damage, otherwise known as diabetic neuropathy. What you may notice is a tingling sensation or even numbness in your hands and feet. Some people also experience pain in their hands and feet. Although neuropathy is more common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. Number 3. Blisters, dryness, or other skin changes. Small patches of extra skin, called skin tags, can form in skin folds, especially if you have diabetes and are trying to find ways to control your weight, notes the ADA. Dark, thick areas of smooth skin, called acanthosis nigricans, can form on the back of the neck or on the hands, armpits, face, or other areas. These can be a sign of insulin resistance. Blisters, infections, dryness, itchiness, discolorations and skin abnormalities can all be warning signs of high blood sugar. Check with your doctor if these skin changes develop. Number 2. Yeast infections more often than usual. Hyperglycemia can lead to more frequent genital yeast infections. The culprit is often a type of yeast, a fungus, known as Candida albicans, according to the ADA. According to the Centers for Disease Control and Prevention, in women, symptoms can include vaginal itching, redness, or pain during intercourse, pain or discomfort when urinating, and abnormal, thick vaginal discharge. While yeast infections are common in people who don't have diabetes, having more glucose in your blood increases your risk of getting them. The yeast feeds on glucose, and if your blood sugar is high, there's more glucose in your urinary tract. Uncircumcised men with hyperglycemia are also at risk, he says. Number 1, swollen or bleeding gums, which increases the risk of infection. Your saliva contains glucose, and the more it contains, the more there is to feed the bacteria that combine with food in the mouth to form plaque and cause gum disease. Symptoms can include red or inflamed gums at first. If left untreated, they can progress to periodontitis, which can cause the gums to pull away from the teeth, the appearance of pus or ulcers, or even loss of teeth, notes the Mayo Clinic. Control your blood sugar and see a dentist to prevent damage to your gums and teeth. Font: everydayhealth.com